Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hey everybody, this is Nitin Chhoda over at www.intouchemr.com, and in this video training I'm going to teach you how to streamline patient intake. Here's how the ideal patient intake process should be. The patient calls your clinic usually a day or two before the appointment. Automatic online eligibility verification should be done for that patient using your EMR service. It's what we do at intouchemr.com. Once the patient's eligibility is verified, that information can actually be used to create a patient record with the click of a button. You don't have to manually enter all the patient's information like their date of birth, like their address. So there's patient chart creation that can happen automatically. And like I said, all this can happen within InTouch EMR and our associated billing software, InTouch Biller Pro. Once the chart has actually been created, the next step is to schedule the patient. And this can be done by the front desk. So now what happens is, before the patient comes in, the eligibility is done, the chart's been created, the scheduling has been done. And once the patient actually does come in, at that point, imagine if the patient was given an iPad and the patient was asked to complete the rest of their intake. What that means is, the patient has the iPad in front of them, the patient enters all their own information, such as emergency contacts, perhaps even their chief complaints. The patient enters details of their secondary insurance company. The patient enters any additional addresses that they may have. The patient enters the kind of medications that they're taking. The patient himself or herself enters all that information. And then on the iPad itself, the patient is actually able to take a picture of his or her own insurance card, his or her own physician prescription, driver's license if you need it, and all of this automatically gets added to that particular patient record. Imagine if all this happened on an iPad, and on the last page of that iPad screen, the patient signs off on a HIPAA agreement where the patient's allowing you to access the health information. Standard procedure. If all of this happened even before the patient saw the physical therapist, that makes the entire patient intake process extremely streamlined, because all of this happens even before the clinician gets involved. The clinician gets involved after all of this is done, and in fact a lot of this can be completely streamlined. Your front desk, all they do is they take the patient's insurance information, they verify online eligibility using a service like InTouch Biller Pro. The patient chart's created automatically, the scheduling is done within 2 minutes. Once the scheduling is done, the patient now checks in himself or herself on the iPad. This is done the first time. This doesn't happen to happen every time. This is a one-step, initial patient intake, and then the document is created, and the physician or the clinician rather can do the rest of the documentation. So I hope this video was beneficial for you. For more information, please go to www.intouchemr.com to learn more about how we can help you streamline all of this with InTouch EMR. You can even visit our website to get a free report on the 5 blunders to avoid with EMR, and we'll send that to you. It's a free full color report. We'll send that to you even if you choose not to work with us, because that report will help you streamline several things in your practice and not just patient intake. Thank you so much for watching. Good luck, and we'll talk to you soon. Bye-bye.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.